Hello, my name is Sigrid Tubadesa and my ID number is 444516.
I'm Ana Cabradilla. My student number is 445973.
I'm Janice Lagat. My student number is 433831.
Today, we will be showing you how to properly don and doff personal protective equipment.
And I will be doing the proper sanitation process.
I will be doing the disinfection and wrapping.
Medical sepsis is a type of infection control that decreases the risk of spreading infection by destroying microorganisms. This can be achieved by wearing appropriate personal protective equipment or PPE, practicing proper hand washing. PPE is a specialized clothing or safety items used for airborne, droplet, and contact precautions. I will show you the proper way to don and doff the PPE, and donning is done outside the patient's room. First thing that I should do is to tie my hair and check my nails and hands for any cuts. Remove jewelries as they may harbor microorganisms. I have here my Mayo table, and the first thing I will be needing is the gown. The gown will protect me from splashes and sprays or droplets. An N95 mask for airborne precaution, or if you don't have one, just a plain surgical mask. Gloves, which serves as a barrier to prevent transfer of microorganisms, and face shield or goggles for droplet precautions. I will also need a hand hygiene station where I can perform hand washing. This is essential to eliminate potential to contract diseases. It is performed for 20 seconds before and after handling contaminated materials. I have already done my hand washing, and the first thing I need to do is wear my hair bonnet to prevent splashes or droplets to contaminate my hair. Then, I will check my gown for any defects such as tears or holes, as this may contaminate me when handling a patient. Now that I am gowned up, the next will be the mask. I will hold it on the string and pull it behind my ears and mold it around my nose and check for air leaks to protect me from any airborne precaution that might be aerosolized. And then I will wear my face shield. The padding should be placed on the forehead. The face shield will protect me from any contact or aerosolized splashes. Next will be the gloves. I will put the gloves on and make sure that I will pull the gloves above the cuff of the sleeve so that no skin is showing. A double glove can also be done. In case of contamination, I can always do the hand hygiene with the gloves on to decontaminate. Now I am ready to go inside the patient's room, and I will be showing you the proper way to doff the PPE. When doffing, I will be needing a trash bin where I can put my soiled or contaminated PPE. The first thing I would need to do is to remove the gloves, as this is the most contaminated. There are two ways to remove the gloves. I can remove my gown and glove at the same time and roll it, or grab the palm of the glove with my other hand and pull it, then just crumple it. Then remove the glove using the other hand and then discard. Then I will do the hand washing, and then I will slip my hand on the inside of the sleeves and then pull it skin to skin, gown to gown, then roll it. Discard. Again, decontaminate my hand and then remove the face shield by pulling on the strings on the side. Do not touch the front of the face shield. Discard onto the trash bin and again decontaminate my hand by hand washing. I can now leave the room with my mask on to prevent myself from inhaling aerosolized virus or infectious particles. Again, repeat the hand hygiene and decontaminate. Now, it is now safe to remove the mask. Slightly bend forward and grab the straps on the side and discard the mask and my hair bonnet. Repeat the hand hygiene, and that is how to don and doff the PPE.
So the next process is sanitization. In this procedure, you will learn the standard precaution for removing contaminated matter from the instruments in preparation for disinfection and sterilization. So these are the materials needed, like the sink with running water, soft brush, towel, disposable towel, protective apron, heavy-duty gloves, goggles, face mask, and we have our surgical instruments like the scissor as our surgical scissor, the fork as our scalpel, and spoon as our ovum forceps. We have three different types of instruments that are used in the surgical field. First one is critical instruments. So these are used inside the body cavity or under the skin like scalpel or forceps. Second one is semi-critical instruments. So these are medical equipment or device that comes in contact with non-intact skin or mucous membranes but ordinarily does not penetrate them. For example, the cystoscopes, laryngoscopes, and some endoscopes. The third one is non-critical instruments. So these are devices which come into contact with intact skin. For example, stethoscope or blood pressure. I'm done with my hand washing and ready to start sanitizing our instruments. So I put on my PPE for me to protect my body and eyes from any exposure to blood and body fluids through splashing or punctures. If instruments need to be transported from one place to another, place it in a container and label it biohazard. Separate also the sharp instruments from the other instruments to prevent injury. Rinse instruments in cool running water and place in disinfectant solution. This removes any tissue or debris that might dry onto instruments. With a metal brush, scrub each instrument well using water and detergent. So for example, we have here a surgical scissor. So we should focus on the hinges, scrub with the direction of the serrations, then the opposite way, and then the other side, and then to the grooves, side to side, the four sides of the tip, the handle, and then the both ring, inside and out, and the lock box. Scrub with the direction of the serrations, the opposite way, then the other side. So let's see to it that our instruments is clean and free from pathogen to avoid contamination. Rinse instrument with hot water to remove all soap and contaminant residue left behind from disinfectant solution, and place each instrument in a clean towel. After placing the instruments on a clean towel, dry the instruments with a paper towel. Make sure that the instruments are dry to avoid rust and so that it will also not affect the concentration of our disinfectant. We should also see to it that our instruments are in good condition. For example, our surgical scissor. After sanitizing the instruments, remove PPE and do hand washing. Towel dry hands and dispose it in a covered biohazard waste container.
The term disinfect pertains to a chemical or physical means of destroying bacteria. First, we'll put on our PPE because chemical disinfectants can be harmful if exposed to the skin. Then prepare solution and pour into a container with an airtight lid, being careful not to splash the chemical. Close the lid securely and label the outside of the container with the name of the solution, date, and time required according to the manufacturer for sterilization procedure. In wrapping instruments, we need permeable autoclave wrapping material, autoclave wrapping tape, felt tip, sanitized hemostat or your instruments, cotton ball, and sterilization indicator. First, we need to wash our hands and assemble all necessary items. Ensure that items have been sanitized before wrapping for autoclave process. Check items for flaws and make sure they function properly. And then place a cotton ball between any hinge instruments and keep all ratchets open during the sterilization process. Put a sterilization indicator in which the instruments can be wrapped. Wrap the tip of the sharp instruments with gauze to avoid puncture of the wrapping materials that causes contamination. Wrap item using the first square by folding the corner of the paper towards the center and turning a small corner back towards you. Continue wrapping the items by folding one side towards the center, leaving a small corner towards you back on itself, and then do the same with the other side. The package is folded up from the bottom, leaving the last corner out. Fold the package up from the bottom and secure, folding the last corner back on itself. Wrap the package in the second square of paper using the same technique. Be sure there is no opening and seal with autoclave tape. Wrap items snugly. Label the contents and write the date and your initials on the tape.
The appropriate use of PPE is one of the most effective strategies for protecting both patients and healthcare providers from transmissible pathogens.
So proper sanitation promotes health, improves the quality of the environment and the quality of life in the work field.
Wrapping items to be autoclaved so that they will be protected from contamination after the sterilization process is completed for storage and handling.
Standard precautions are intended to reduce the risk of transmission of bloodborne and other pathogens from both recognized and unrecognized sources.
They are the basic level of infection control precautions that are to be used as a minimum in the care of all patients.
So we, as the medical office assistant, should also comply with infection control practices within their office and clinical settings.